Hello everyone. Today I am here with another interesting topic, that is the psychiatric terminology. Psychiatric terminology, it is a very interesting and important topic for the student who are doing study at the GNM level or at the BSc nursing level. So psychiatric terminology is the pillar of the psychiatric subject. Because all the psychiatric subject is depends upon the psychiatric terminology, so we all should try to learn all the terminology related to the psychiatric. First terminology is related to the disorder of thinking or disorder of thought, that is related to the thought process, how a person think. So first word is flight of ideas. In flight of ideas, patient thought moves very fast, jumping very fastly from one topic to the another topic. These type of the problems are usually seen in the mania patient. And for example, patient says that I am great, today is sunny, I will start a company, you know my friend. In this way, patient's ideas jump very fastly from one topic to the another topic. Next terminology is circumstantiality. In circumstantiality, when we ask something to the patient and the patient start answering, the patient add too many unnecessary details but finally reaches the goal or the point. This is commonly seen in OCD patient, schizophrenic patient. For example, yesterday I woke up at 6 a.m., brushed my teeth, made tea, then went to the doctor. Third terminology is tangentiality. It is also related to the thought process. It is similar to the circumstantiality. In this terminology, patient also add unnecessary details in their conversations, but patient or persons never reaches to the point. Seen in schizophrenia, examples: how are you? Patient gives the answer that weather is a good, people talk too much, roads are crowded, but he or she is unable to explain how she is or how he is. Next is loosening of association. In loosening of associations, thoughts are disconnected and illogical. They are not connected to each other. These are the classic sign of the schizophrenia. I like apple, the sky is blue, dogs are honest. Next is perseveration. In perseveration, patient repeating the same word or ideas again and again. These are seen in dementia, brain injury. For examples, we ask something from the patient. What is your name? He asked us. What do you do? He asked us. What is your age? He asked us. He speaks only one word or one ideas. He never switches to the another word. That is the perseveration. Next is thought content. What a person think. In thought content, first word comes to delusion. What is a delusion? Delusion is nothing but it is a false fixed belief that is not true, but person strongly believe that it is a true. That these type of the problems are usually seen in schizophrenia. Delusional disorder or types of delusions are delusions of persecution, delusion of grandeur, delusion of references, delusion of control. Delusion of persecutions: people are trying to harm me. Person thought that or patient thought that another peoples are trying to harm me. Delusion of grandeur: patient thought that I am God, I am all in all, I am a Prime Minister of India. Delusion of references: patient thought that another persons are talking about me. In TV channels, news are broadcasting about related to me. Or delusion of controls: persons develop a false fixed belief that they are controlling my thought. Next word is obsession. Obsession and compulsion, these are the two words. Both are related to each other and both are present in the OCD. OCD is a psychiatric disorder, obsessive compulsive disorder. In obsession, patient develop repeated unwanted thought. Again and again, same thought, unwanted thought that are coming in their mind, and that cause anxiety to the patient. Fear of touch, repeated thought of hand washing. So compulsion is, what is compulsion? Compulsion is a repeated action done to reduce anxiety. These are also seen in OCD. When patient develop repeated thought, after that he again he want to do the repeated action. For example, to remove the dirt, he wanted to wash the hand again and again. Next terminology is related to the disorder of the perception. These are two terminology. One is hallucination and second one is illusion. In hallucinations, patient seeing or hearing something without real stimulus. There is no real external stimulus present. Patient suffered with auditory hallucinations, visually hallucination, olfactory hallucination, tactile hallucination, and another different type of the hallucination. In auditory hallucinations, he or she hearing voices, most common in schizophrenia. Visual hallucinations, he is seeing things. Olfactory, smelling bad smells. Tactile, feeling insect crawling. For example, I hear voices telling me to hurt myself, but there is no true external stimulus. Next type is illusion. In illusion, there is always present a external stimulus, but patient interpret that in the false interpretation of that stimulus, misinterpretation of the real object. This is seen in anxiety, delirium. For example, rope looks like a snake in a dim light. Next terminology is related to the mood and affect. These are also two words, mood and affect. Mood is a subjective feeling, sustained emotional state. For example, patient always remain depressed mood. He or she always remain in elevated mood. Or affect is a objective feeling, what we observe. It is the external expression of mood. For example, we observe that flight affect, no emotional expressions on the patient face. Blunted affect, reduced emotions. Inappropriate affect, laughing during sad talk, seen in schizophrenia. So when we want to differentiate in both word mood and affect, we can differentiate in a easy way, such as subjective and objectives. Mood is a subjective feeling, what the patient feel, and repeated by the patient कि patient का mood कैसा रहता है. And affect is the objectives, what we observe, observations. Next is disorder of speech. In disorder of speech, pressure of speech, how the patient talking very fast, talking very slow, difficult to interrupt, these are present in the mania. Mutism, sometimes patient becomes a complete mute, complete absence of speech. These are present in catatonia or severe depressions. Echolalia, echolalia is repeating other people's word. For example, their doctors are saying something and patient start to repeating that word. So echolalia is repeating the word. Next is disorder of attention and concentrations. In this disorders, distractibility comes, easily distracted, mania, poor concentration, depression and anxiety. Next is disorders of memory, amnesia, loss of memory. Retrograde means forget past event, what is happened in the past, उसके previous life में क्या हुआ है, he forget that. And anterograde amnesia means he cannot form a new memory, वो नई memory नहीं बना सकता है, और उसे पास्ट की तो मेमोरी याद है बट जो नई मेमोरी है वो उसको नहीं बना सकता है. नेक्स्ट टर्मिनोलॉजी इज रिलेटेड टू द डिसऑर्डर ऑफ इनसाइट एंड जजमेंट. इनसाइट इज द अवेयरनेस ऑफ हैविंग इलनेस, कि आई हैव अ इलनेस, आई सफर्ड विद मेंटल डिसऑर्डर. सो दीज आर ऑफ द थ्री टाइप्स, गुड इनसाइट, पुअर इनसाइट, नो इनसाइट. इन गुड इनसाइट patient accept illness, poor insight denies illness, or no insight completely unaware about the illness. Poor insight is usually present in schizophrenia. Next is judgment, ability to make correct decision. So intact judgment normal, or impaired judgment poor decision making, it is present in mania and psychosis. Next terminology is related to the behavior, how patient behave. Agitation, in agitation patient usually remains restlessness, unable to sit. Catatonia, abnormal movement or posture, that is known as catatonia. Echopraxia, copying other actions. stupor, decreased response to surrounding. Disorder of impulse control, suicidal ideations, homicidal ideations, self-harm behavior. Suicidal ideation, thought for suicide. Homicidal ideations, thought for killing others. Self-harm behavior, cutting, burning, important for the psychiatric nursing assessment. So these are the some keyword that is a very important for everyone. Psychosis in simple way we can explain it that loss of contact with reality. Neurosis, emotional problem with the insight. Mania, overactive elevated mood. Depression, persistent sadness. Anxiety, excessive worry. Delirium, acute confusion. Dementia, chronic memory loss. So thank you very much. Thank you very much for watching this video. If you found it useful, helpful, please like, share and subscribe to my channel. We will meet again with the second part of the psychiatric terminology.